Hello and welcome to our documentary part, Health, Is It All About the Money? I am Malte and this is Linda, and we would like to give you an insight about the correlation between social class and a person's individual health in England. In order to discuss this topic, we will first give a rough outline of how the NHS works, what the so-called postcode lottery is, and then illustrate our points with some interviews that demonstrate how socio-demographic factors affect the interviewees' lives. For the purpose of drawing conclusions about the topic, we will again focus on the question of how and to what degree does social class affect individual health.
Thank you, Malte, for the introduction. A person's individual health is strongly connected to the medical infrastructure and system he or she is situated in. The National Health Service, short NHS, is a publicly funded national healthcare system for Great Britain and Northern Ireland. It provides the majority of healthcare in England, including primary care, inpatient care, long-term healthcare, ophthalmology, and dentistry. The National Health Service Act 1946 came into effect on July 5th in 1948. The NHS is the largest single-payer healthcare system in the world. Single-payer healthcare, therefore, is a healthcare system financed by taxes that covers the cost of essential healthcare for all residents, with costs covered by a single public system, hence single-payer. In comparison, a multi-payer healthcare system, like the one in Germany, is one in which private qualified individuals and/or their employers pay for health insurance, with various limits on healthcare coverage via multiple private or public sources. The sickness funds are based on a combination of statutory health insurance and private health insurance. This difference was initiated by the principle of, on the one hand, William Beveridge, and on the other hand, Otto von Bismarck. The ideal of the National Health Service was formulated in a government document in 1944 as the following. One of the fundamental principles of the National Health Service is to divorce the care of health from questions of personal means or other factors irrelevant to it.
But does this reflect reality? What do we know about the individual access to the health system of England?
Primarily funded through the general taxation system and overseen by the Department of Health, NHS England provides healthcare to all legal English residents, with most services free at the point of use. Some services, such as emergency treatment and treatment of infectious diseases, are free for everyone, including visitors. Free healthcare at the point of use comes from the core principles on which the National Health Service was founded by the Labour government in 1948. In practice, free at the point of use normally means that anyone legitimately registered with the system, i.e. in possession of an NHS number available to all legal UK residents regardless of nationality, but not non-resident British citizens, can access the full width of critical and non-critical medical care without payment, except for some specific NHS services, for example eye tests, dental care, prescriptions, and aspects of long-term care. These charges are usually lower than equivalent services provided by a private provider, and many are free to vulnerable or low-income patients.
Thank you, Linda. As we have heard, the NHS is supposed to offer the same treatment and medical access to the entire English population. But is this really the case? Have you heard people talk about the so-called postcode lottery before?
Well, I have heard about it before, but what is it?
The postcode lottery is a topic that has been coming up more and more when talking about the NHS and its most recent reforms. At the top of the NHS is Secretary of State Jeremy Hunt. He is also in charge of the Department of Health. The money, which is a budget of about £120 billion for the NHS services, goes from the Department of Health to organizations called Clinical Commissioning Groups, short CCGs. They are made up of GPs, hospital doctors, nurses, and members of the public. Each CCG is responsible for improving the healthcare in the particular part of the country they represent. They do this through commissioning the use of money they receive from the Department of Health to buy products and services that they think are the most useful for their population.
But what if a certain area has different needs than another area?
That is exactly the problem, Linda. The CCG of one area, for example, might think it is better to spend money on services that work to reduce smoking, whereas a CCG of a different area might decide to spend money or more money on nursing homes to help a more aging population.
But this means that by giving the CCGs the power to make decisions as to what is most appropriate for their local population, it may mean that there are differences in the level of healthcare from region to region.
Exactly. This makes the postcode lottery a problem within the NHS, where different patients receive different levels of healthcare depending on where they live.
What about other current challenges facing the NHS?
Well, the NHS is confronted with various challenges and issues which are to some extent comparable to health systems all over the world. Like, for example, an aging population, several changing lifestyle factors, the change of public expectations, rising costs, advances in medicine and technology, or doctors per inhabitants.
This is interesting. How is the NHS reacting to these developments?
Obviously, on the one hand, the NHS tries to create an awareness of health among the English population, and on the other hand, the government has increased the budget of the NHS continuously, which will be illustrated by the following graph.
Important measures for sure, but is it enough to tackle the current challenges, and do these measures satisfy the overall population? In order to try to find an answer to this question and to the question of a correlation between health and social class, we decided to design a questionnaire for English citizens. We will share the results with you in the following section.
Yes, we designed a questionnaire that was completed by several citizens who belong of different social classes. To classify their social status correctly, we asked each participant to do the Great British Class Survey online, which was published by the BBC, so that the definitions and classifications are standardized. The interviewees were asked several questions about their health status and behavior, for example, whether they smoke, exercise, and what their diet is like, and what they do for a living. Therefore, you could also click on the video for consumer behavior within our video series. Furthermore, the participants were asked about their experiences with the NHS. Some of the questions we used were: have you ever been denied treatment at your local facility because of your current health plan? Have you ever needed treatment that was not available to you, but to others depending on their financial situation? Have you ever needed treatment that was not available in your area, but was available elsewhere? And have you ever needed particular medical treatment that required unreasonable waiting times, and would those have been shorter at a facility elsewhere?
In addition, the participants were asked whether they had experienced the circumstances of the so-called postcode lottery themselves, and whether they felt as if they had advantages or disadvantages in comparison to other social classes or groups.
Very interesting. Let's have a look at the results from the questionnaires, and let's have a look whether this answers our question about how and to what degree a person's social class affects their health status in England.
The detailed questionnaire was not intended to constitute a scientific and representative study, but rather to collect various people's opinions and attitudes towards the current medical infrastructure in England. Therefore, it was answered by 4 people who came from the area around London, as well as the suburbs of Manchester. 3 people live in close proximity to the big cities, and 1 person lives close to Canterbury, which in comparison to London and Manchester is a more rural area to the east of London. Furthermore, 1 respondent is retired, 1 works at a hospital, and 1 at a content writing agency, and 1 at a newspaper. Together they cover the age range from 24 to around 70.
Well, all of them say that they try to eat as healthily as possible. All of them are non-smokers, and all of the people surveyed are characterized by at least some level of physical activity. With regard to our initial guiding question about the correlation between social class and health, we can first observe that all the people surveyed are mostly happy with the current structure of the NHS. This means that the interviewees are satisfied with both the individual medical situation as well as the medical measures which are available to them, regardless of their social class. Moreover, none of the 4 respondents claim to have needed treatment from a local medical facility that was not available because of their financial situation.
This sounds very positive. In comparison, all the participants also seem to be aware of the infrastructural issues which are connected to insurance in the so-called postcode lottery, but only 1 interviewer describes an individual experience. In this case, he fractured his leg and had to wait 3 hours for immediate treatment at a hospital. In this context, the question arises of whether this happened due to staff and time shortage, or rather the form of insurance. Additionally, he describes a clear difference between the medical infrastructure in London and Canterbury. This is illustrated through fewer hospitals and GPs, which are also more spread out in Canterbury.
What else do the participants say? Regarding to the privatization of health insurance, one of them even speaks about a clear division which takes place. This division mostly appears in terms of waiting times and the form of medical treatments. Another interviewee further complains about the fact that she has to wait several days to see the GP unless she joins the queue at 8 a.m.
These results therefore show an ambivalent public opinion on the topic and the correlation between social class and health. On the one hand, all the participants are mostly satisfied and happy with their individual medical circumstances, as well as the current structure of the NHS. Different social classes seem not to be a factor here. On the other hand, they are also aware of current challenges like waiting times, an aging population, the number of doctors per inhabitant, and the impact of personal means. Furthermore, possible developments in terms of private insurance seem to play a big role, which is then strongly connected to higher social classes.
In conclusion, we could therefore probably say that the medical and health system in England, the NHS, currently does satisfy a large part of the English population, regardless of their social class. The financial and structural organization of the NHS mostly still seem to meet the current needs. But obviously, present challenges are comparable to other health systems all around the globe. Like we said, an aging population, several changing lifestyle factors, but also rising costs, scientific advances in medicine and technology, or even the doctors per inhabitants will therefore have to be faced by English politicians in the future, or even now, to guarantee the continued existence of the NHS and its satisfaction among the English population. Various approaches to reforms are already part of public debates.
With regard of the privatization of health insurance and its effects, the risks of a two-tier health system and an unequal treatment have to be considered. At this point, the ideal of the NHS, which was mentioned at the beginning of our video, clearly seems to contradict the current development. One of the fundamental principles of the National Health Service is to divorce the care of health from questions of personal means or other factors irrelevant to it. Therefore, the following questions must be allowed. Is the ideal of the NHS still the case? And how is it possible to close the gap in terms of political reforms? Last but not least, and in connection to our initial question, as well as the questionnaires, social class seems not to play a big role regarding the NHS, but it becomes important when we talk about privatization of the health system and its implementation.
Other factors like nutrition, drug abuse, or sports activities are clearly also connected to the correlation between social class and health, but these aspects are individual and different characteristics can be found in different social classes, which are then maybe contrary to the public opinion. Therefore, the current scientific research about these points was not part of our video. If you are interested in further statistics about the current state of health within the United Kingdom, we would recommend the 2018 dossier of Statista to you, which can be found here. We hope you enjoyed our presentation about the correlation between social class and health, and if you want to know more about the other correlations regarding to social class, click on one of the following videos within our video series.
Thank you.